So we'll just wait for a couple of minutes for everybody to join in,
Sure.
then we can start. Hi, everyone. I think, yes, we should start now. I was just waiting for more people to join in, but I think they can join as we begin. So, hi, everyone. Very good evening to everyone here who's joined us today, and thanks for joining and taking the time out. Very quick introduction. I'm Smriti Agarwal Gambhir, and I look after the investor relations function at IN. After two very informative sessions on generative AI, we're back today for our third session in the generative AI series to talk about Gen AI's applications in healthcare. Now, of course, coincidentally, this also comes at a very, very interesting time when Google has made, they've revealed a very groundbreaking development in the Gen AI space with regards to healthcare. And we'll see what we can speak on this later in the session. But in today's session, what we're going to focus on more closely is how Gen AI will impact the healthcare industry and for this, we have with us today Mr. Sehaj Kashyap, who currently leads product at Clinique in Bangalore, where they have been building healthcare and financial protection for almost 600 million Indians. Previously, Sehaj has helped deploy machine learning aided clinical workflows at Duke and Stanford health systems and optimized India's national digital health tool for screening and management of chronic diseases in rural India. We also have with us Siddharth Ramesh, who is a doctor by training, but a developer at heart. He's founded MedBlocks in 2015 and currently serves customers all around the world to deliver better healthcare. Siddharth and Sehaj, thanks a lot for joining us today and taking out the time. What we'll do is that we'll, ask Siddharth and Sehaj to take stage and speak on the content that they have to share with us. And I'd request all the participants to keep putting in their question and answers in questions in the Q&A box, which Siddharth and Sehaj can take up post they speak. Right. So on that note, I'd like to pass the baton to both of you, Sehaj and Siddharth. Please, over to you.
Thank you so much, Smriti. Thank you, everyone, for having us, the community here, and hope we're able to share something of value with you all this evening. Sid, any opening remarks from your end?
Yeah, hi, everyone. Nice to be here. So hope we provide some value to this webinar.
Yep. So what we're going to do is go through our slide deck in which we're going to show you a demo of a generative AI application that Siddharth and I and some team members of ours developed over a weekend, and then go through use cases and applications that we're tracking in the generative AI and healthcare space. So maybe after the demo, if there's a natural pause for questions, we can take that. Or towards the end of this, we can just open up the floor to any and all questions. I'm going to share my screen and we'll get started. Do let us know if the audio does not end up coming through the webinar. All right, so what we're actually going to show you is a demo that Sudhart, myself, and a couple of our team members, Purna and Anukriti, made over a weekend. Collectively, the four of us have been working in healthcare and health tech across various different projects, initiatives, and companies, as well as having deployed machine learning-based clinical decision support tools at hospitals, for example, Duke and Stanford. So what we're going to demo to you first is Paco. It's something we built as a proof of concept. It's not something ready for production, but something that we were able to spin up in a weekend time to provide value to doctors as well as patients. So I'm going to play that right now. Please let me know if you are not able to hear the audio.
Is called PacoDoc, and we have this is first.
Are you able to hear the audio?
We can hear it.
Good.
The helper UI for doctors. Okay, now Saj is going to be my patient, and he has come up with some, he has a situation in his mind which we haven't gone over before. This is the first time we are actually going to try this out. Let's see if we are able to figure what diagnosis, Sahaj has. So, hi Saj, what brings you in today?
Hi, Doc. I've just been feeling very tired over the last few months. I don't know what's going on.
Okay, so you've just been generally tired for a few months. How many months exactly?
Yeah, like 2, 3 months. I recently got diagnosed with type 2 diabetes. And I'm on some meds. I think it might be the meds, but I don't know. It's just not helping.
Okay, so what have you been taking for your diabetes?
I don't remember the name of the medicine. It's some pill that I have to take. And I was just given it last few weeks ago. But it doesn't seem like it's getting any better. And I've been checking my levels. It's just not working.
Okay, so your pills are not controlling your sugars. Is that it?
Yeah, it doesn't seem to be. No. And I'm just tired. I thought it was, maybe I'm just overstressing myself, but yeah.
Okay. Do you have any other symptoms apart from just being tired?
I have been feeling a little bit nauseous here and there every once in a while. Yeah, and I guess I've been going to the bathroom many times, more than I usually do. So that's been going on.
Okay, okay. So it seems like, do you have any idea about your sugar levels? When was the last time you checked? How much was it?
I think it was like over 200s when I last checked it in the morning. Yeah.
Okay, that's pretty high, and I think you have it's uncontrolled diabetes, and just your sugar levels might cause a lot of side effects. Being tired, going to the bathroom a lot are some side effects of high sugar levels. But just to be sure, have you made any changes to your routine? Have you been changing your diet or exercise after you've been diagnosed with diabetes?
I mean, I've been feeling tired. I thought it was maybe exercise related. I stopped exercising, and I just don't have the energy. Yeah, I don't really have the energy at all. So that's about it. Yeah. And I guess I've been wearing a little bit more sunscreen. I've been just noticing that, yeah, just maybe I'm darkening up a little bit.
Okay, so you also have hyperpigmentation. Is it on your face? Is it all over your body?
I'm just noticing, I think maybe my arms just, yeah.
Okay, okay. Do you feel more hungry or less hungry?
Yeah, less sort of appetite, just tired in general.
Got it. Do you feel colder than usual, or do you think you're feeling warmer than usual? Do you sweat a lot?
Yeah, I guess I've been sort of, yeah, I've been not using the AC I usually do. Yeah.
Okay. This could be an endocrine problem as well. I'm also going to just take a look at the exact drugs that you are on. I'm going to prescribe a few lab tests for checking your T3, T4, TSH levels. And your sugars, I believe you've been checking them regularly, but let's get a fasting blood sugar and HP A1C also done. And for now, I think we should first stop your medication, whatever you're on, just to make sure that the medications aren't causing these symptoms. And let's wait for the lab test to come back, and then we'll go from there. How does that sound?
Okay, that sounds good.
Right. So I'm gonna generate the prescription just automatically. Let's say I think you probably were going for hypothyroidism.
No, so I was actually kind of going for Addison's, or
Okay.
yeah, or sort of an autoimmune version of uh, essentially type 2 diabetes, like a latent um, uh, diabetes that could be more on antibody sort of mediated.
Got it.
So yeah, but it
Got
was a very, very tough case that I just threw at you, and neither of us have looked at this in a long, long time. So
Okay. No, I think, see, the suggestions that it's giving me immediately hypothyroidism, adrenal insufficiency, medication-related side effects for diabetes, uncontrolled type 2 diabetes, chronic fatigue syndrome, right? And I my clinical thinking has been like, okay, fine, it might be a very specific type of adrenal insufficiency or hypothyroidism, but gain, weight loss,
seeing things that maybe the audio transcript doesn't even have. So imagine this is just the first step, but imagine if you could combine what your expertise and your visual mode of data is with what the model knows, and how could
right?
that help you? So
Right.
you might be, for example, my bronzing sort of skin or
The
my
audience,
hyperpigmentation, which the model doesn't have access to, but you have access to that.
right. Now, again, like I'm just auto-generating the prescription right now, and it got all of it right. Like, just medication, discontinue the current diabetes medication, lab test T3, T4, TSH, fasting. I didn't type anything. It's all from the transcript. We are getting that. And again, to people who are listening, right, like GPT-4 is not specially trained on any medical knowledge. Is possible here.
So did it get the symptoms right? All the reviews?
I should have asked your age. Should have fed it in the model. Okay, let's just ask it simple questions first, and then
Yeah.
maybe just chat with it in English.
Yeah. Let's start there.
Okay, I'm gonna just type it in the chat, like what is my diagnosis?
Yeah.
So based on recent clinical notes, you've been diagnosed with suspected hypothyroidism and uncontrolled diabetes. If you have any questions about your medications or lab tests, feel free to ask. And we also have an audio.
Based on the recent clinical note, you have been diagnosed with suspected hypothyroidism and uncontrolled diabetes. If you have any questions about your medications or lab tests, feel free to ask.
I'm gonna start.
Maybe ask about, or do you want me to ask a question? Maybe.
Yeah, go ahead. Go right ahead. I'm gonna start the patient microphone. So
ओके डॉक्टर ने लैब टेस्ट कौन से ऑर्डर किए हैं?
It's, it detected Arabic. I don't know why, but okay, maybe it's another. It might be Urdu. I'm not sure.
My language, what language I'm speaking.
Got it. So I tried this in Tamil yesterday, so it was not bad at all. Then I'm gonna just play the response in Urdu.
1. T3. Triiodothyronin 2. T4. Thyroxine 3. TSH. Thyroid stimulating hormone 4. Fasting blood sugar 5.
Serge, you're on mute.
Okay, everyone. So I'm going to stop there. And that was to show you a demo of something that we built to explore what is an application of generative AI in healthcare. Both Sid and I are trained as doctors, and this was a use case that we were interested to see. Could it help a doctor interview a patient, make a diagnosis, write a clinical note, as well as provide the patient support in the language of their choice? This was a proof of concept. So whatever questions you have about this, we'll be happy to answer that. But this was just a sense of giving you what might be already possible with generative AI technologies in healthcare. But let me move on to what exactly is happening under the hood. So what's happening is that the software is listening into a spoken conversation, is using an OpenAI technology called Whisper, and is transcribing. That raw transcript is going live into 2 different instances of the GPT-4 model and giving the doctor a list of potential diagnoses, as well as questions to ask that might be relevant for that patient-doctor visit. When the visit is over, we use another model instance to take all of this information and automatically write the prescription. And finally, the patient can talk to that prescription, ask questions, and use their voice or use text to get answers to their prescription, making sure that the answers are never deviating from what the prescription has said. That's kind of how this works. Sid, if you can help me just monitor the chat for now, that would be helpful. I can stop them. So you might be asking, we're using GPT-4, the natural sort of question after that is, does something like GPT-4 have medical knowledge? And what we'd say is, the short of it is Google and OpenAI's, these large language models, encode some clinical knowledge to the point where they can basically help you do medical assistant work. And as we kind of see in the headlines, they're able to answer medical challenge questions, so licensing questions at expert levels. Here you have GPT-4 and MedPalm by Google answering USMLE questions at expert levels. But we just want to caution you to not get carried away with that hype of exam benchmarks, because they're not the best way to tell whether LLMs will be useful in healthcare and where they'll be useful. This is a helpful figure that was presented in a blog post about a lot of the headlines are around looking at GPT-4 on exam benchmarks. But that doesn't tell you in the real world, if a doctor were to ask GPT questions, would they find the information useful? Would it be able to help them in real world tasks? That's kind of where we're wanting to explore. What we've done here is basically take a general model like GPT-4 and with some clever prompting techniques, made it do a medical task. But there's many other ways to get a large language model in healthcare that can do healthcare applications. And I want to cover that briefly before we go into examples of things that are possible. So one is you can just take a general model that's been trained on internet-wide data and then fine tune it or basically adapt it to the healthcare use case with a smaller data set. That's what Google did with MedPalm 2. They took Palm, which was internet level, and they fine-tuned it on small set of medical data and then asked it to do the medical challenge questions. But then there's also companies, new companies, depending on how much they're able to fundraise, training these large language models from scratch, where they're not only training with internet level general data, but also clinical biomedical data in the training aspect. Now, we're going to cover some of those companies later, but if you're doing this from scratch, and you're doing this on a large data set and large model, a generative AI model, then it's going to cost you a lot of money. Whereas maybe you go with a smaller model and just clinical data, in that case, you're kind of in this top row, clinical notes plus fine tuning. But what's really here is that unlike the machine learning technologies of the past, medical AI or generalist AI, generative AI has unlocked a lot of different potential, where not only can you start doing the kinds of things that we've demoed to you, but you can start getting general models that doctors and other healthcare people can have very flexible interactions with. They can get help around administrative note stuff, as well as trying to find out more about radiology reports to biomedical applications. And those models can not only act on text data, but also things like images, signals from things like EKGs, audio, text, combined with clinical scientific reports, publications, scientific knowledge, etc. So maybe a way to sort of organize the different use cases that are possible is think of it as, where could we apply it? Could we apply generative AI in the delivery space? So this is the actual delivery of healthcare to the patient. So whether you're a hospital staff, doctor, or back office operator, can the application or the technology help you improve the delivery of the care? Or the other is, can it help you improve the practice of medicine? So can it help you pick the right treatment? Can it help you identify which patients are at risk for a certain diagnosis? And another class is, can it help you with the fundamental science of healthcare? Can it help you identify new subtypes of patients that could help get better treatment, or discover new molecules that could be turned into drugs? So the science, practice, delivery, this is a helpful framework that Nigam Shah, a professor at Stanford, has organized applications of AI and machine learning in healthcare, and I think that's useful here. So here's an example of something that's even extended beyond what we have done. It's called Doximity Docs. Doximity is a clinical social networking and more website that doctors in the US use. They've actually come out with this web app, which helps doctors automate some of their mundane administrative tasks. So you can use their web app to write an insurance letter, write a letter to a patient, a progress note, a procedure note. There's a lot of burden that they don't necessarily have to do. Or let's say an insurance company has denied their request for a certain treatment. Well, they can actually appeal that denial, but not have to write all of that. They can just have it ready to go with GPT that has been fine-tuned. Here's Abridge Health. They've gone even further in terms of just clinical documentation, helping doctors write the note in a much more automated way and make edits easily. So you see that from that transcript, they've done the chief complaint, the HPI, the plan, the prescription is basically being written for the doctor. Here's another one that's helpful. Glass Health. They are essentially trying to upskill doctors through their own smart notebook. It's a smart notebook that doctors can put their clinical notes in, patient cases that they see, and over time, the model will help you learn things about the patient's diagnosis, which you may have forgotten, consider other diagnoses. Basically, in a private way, the doctor can improve their learning of medicine in a smart notebook. This is, again, very much powered with the latest large language models and generative AI technologies. Here's something else. I want to show you the video, but actually they've put the demo out. But they've been able to create a voice-based LLM for elderly patients who might be facing loneliness, which has a negative impact on health, to be able to talk about anything that they want with the assistant. So they can call on a feature phone, they can start talking, and as they talk, a voice to text model communicates with a generative AI model, which then speaks back to the elderly patient. So, imagine hiring or recruiting someone who's a care manager or a nurse to do these phone call checkups or phone call support, and instead being able to do this simply using voice to text and text to voice generative AI technologies. Here's Memora Health. This is a different company that is essentially trying to do various aspects, some of what we've already talked about, but also do things like automate the patient check-in. Now that, rather than these stiff rule-based check-ins, can you have natural language patient check-ins to cut the wait time, or automate replies for inboxes, or basically do symptom checking and symptom collection and patient education? Can you use a mixture of these large language models and generative AI technologies along with some smart clinical knowledge technologies? And here's something that someone coded up on their iOS device, which talks to their Apple Health data. In this, what they're basically doing is going to Health GPT, in which they can ask something like, I feel tired, how much have I been sleeping? And what's happening in the background is the model is talking to their health data, which is on their phone, keeping things private, and being able to give them in a natural way answers like this. Over the past few days, these are the number of hours you've slept, and then being able to ask follow-up questions. Imagine a patient with diabetes or hypertension, rather than having to read graphs, being able to talk to their healthcare data, answer questions, or prepare for a doctor consultation in the future. A company named Hippocratic AI recently raised a ton of funding to try and build safety first large language models that can be deployed in healthcare settings. I think they announced raising about $50 million. They're trying to train large language models that can perform well on not just USMLE, but also board examinations of nurses, physical therapists, specialists, doctors, and they claim that their performance is in many cases more than a general model like GPT-4 doing this. So you can imagine, what can they do with a model that is almost as good as a certified nurse or a certified physical therapist? What are the use cases that they may be able to unlock for a health system that is interested in using their technology? Here's a company called Atropos. We're coming towards the end of some of the examples that we have. What they're doing is a combination of generative AI plus clinical knowledge that is stored in electronic health records. So a doctor can ask a question like, what is a good second treatment option for someone with diabetes on such and such medicine? And using that natural language, the app is able to search the electronic health record of the hospital where the doctor works and come back with an evidence-based, a real-world evidence-based answer that the doctor may be able to use. Now, this is not just using the medical knowledge of the AI, generative AI model, but also the electronic health record, the practice that the hospital or health system has learned over time. Something Sid and I have spoken about and feel strongly about is using these technologies to basically take from messy text, pulling out medical concepts, codes for billing, codes for other use cases downstream. Can you structure unstructured health data using the latest technologies in this space? And last, can you use this technology to actually do fundamental science? Can you describe a drug that is a protein in text, describe the kind of target in the body that it needs to be able to attack, therapeutic properties, and have the model generate a candidate drug, which you can then test in the wet lab or in certain candidates in human trials, basically speed up drug discovery and drug development process. So those are kind of some of the applications. Some important notes that we would just say that may not be spoken about enough. A lot of the focus right now is actually on outputs versus embeddings. So when you put something into a language model like GPT, all of us are kind of used to just getting the text output. But under the hood, something that's happening is it's taking that language that you're putting into the language model, and it's coming up with a numeric representation, which computers can then use for other things. So you can actually imagine that if you take a series of codes for a patient in their electronic health record. So suppose you're in a health system in the US or in certain European nations, patient records are actually, patient notes, but also a ton of codes. Can you treat the codes as language and then feed that into a language model and then find out, well, this series of codes, are there any other patients that have a similar type of series of codes? Are there any other patients who had these series of codes and also developed a diagnosis which was not yet made? So just the idea of outputs versus embeddings, I think it'll be very important in the healthcare space. A lot of companies will probably start to figure out how to use embeddings for useful applications. The other is benchmarks. I think we've already sort of talked about it. Finding the headlines of USMLE has been passed may not be the best way to see how useful are these models in real world. And I think the last thing is these large language models, generative AI technologies, don't just have to exist by themselves. If you combine them with knowledge sources like knowledge graphs or these other technologies like retrieval augmented search, or things that we've done, speech recognition, text-to-speech, or function calls, which is something that GPT sort of announced recently, you can really start to do much more. You don't have to worry so much then about hallucination, which you guys have probably already been talking about. The safety profile starts to go up, and that would be the thing that we'd say at the end is there are kind of some interesting ways of ensuring safety. Not just train a safe model, but can you, expand the ways in which you evaluate these technologies? Is there bias? Is there harm? Is there comprehension? Is there reasoning? And then, while you're deploying these models, can you have these sub-models, sub-agents that are checking the output and making sure it's safe and effective? So We'll end there. Happy to take questions, opening up the floor, and then can speak more about this. So I'll stop sharing right now.
Thanks a lot, Sahej, for that. That was very, informative and great examples, very diverse and very, interesting. So we'd like to open up for questions. So I'll just wait for some questions to come up in the chat box, and we can take those up. So do we have any questions here for Sahej and Siddharth? We got one. So, Sahej, Siddharth, there's a question from Hari. So he needs to ask you, are there any use cases of generative AI being used in India for healthcare currently?
Yeah, I think, Sid, maybe if you also want to take this, we can answer this together.
Yeah, sure. Absolutely. So are you asking, is somebody already using it, or just in general, if there are use cases, then I can tell you there are thousands of use cases, especially in India, which is resource constrained, and we are, constrained by how many doctors there are available for a specific hospital. I think this can augment what non-specialized workers can do, who are using it for what type of treatments. So whether it's actually being used out in the field, maybe Sej, you can take this up.
Yeah, so Hari, thank you for that question. We have not seen a lot yet of generative AI being used for healthcare in India. But I think a way to think about this would be, are the generative AI models that are available commercially or that are available through open source, do they have the kind of, are they able to, do they have enough medical knowledge to be able to start being helpful? One of the big barriers that we see about generative AI here is, can at least patients, can they talk to these models? Can they talk in their own language? Can they get information back in their own reading level, or maybe in their own voice or in their own sort of dialect and language? And until that is possible, we see applications more on the enterprise side, or I would say, like, I would guess the applications will be more on the enterprise side. So I can imagine insurance companies that spend a lot of time in operations trying to figure out things like, is this treatment covered in the insurance policy? This hospital has raised a claim. Should we authorize it for, claim? Is there any fraud happening? Those sorts of things we could imagine generative AI technologies being able to reduce the manual work and kind of make faster. The other sort of thing that I find interesting is actually the example that we showed you, the glass health. I don't know how many doctors honestly will be willing to do something like what we showed in PACO, in front of a patient, have something listening in, giving them notes, writing the prescription for them. I mean, maybe writing prescriptions automatically, but in the safety, privacy of their own sort of after the consultation, can they have notes about the patient that they just saw? Can they keep a record of all the interesting cases? Because you have a lot of MBBS doctors, for example, who are applying for PG seats, who are studying, but still practicing somewhere. So, can this help them learn faster from their practice of care? Can it help them get feedback in a way that doesn't feel like someone's judging them or someone is, grading them, etc.? And then last but not least, I'd be curious to see biopharma applications, drug discovery, drug testing, clinical trial recruitment. We haven't seen this yet, but we think there are applications in India that are possible out of something like that.
Sure, sir. Thank you for that. The next question is from Sanat. What's the regulatory framework to approve Gen AI basis models, and who pays for wrong diagnosis?
Yeah, that's a great question as well.
Yeah. So I'm actually currently in Europe, and I've been getting a lot of questions about what is going to happen with regards to regulation and software. So there is this whole concept that software itself should be treated as a medical device, and you should try to regulate it with the same amount of rules and regulations as you do any other medical device. But for generative AI in particular, I think who pays for the wrong diagnosis? That's a very good question. But I think that there should always be a human in the loop who is approving of the output from Gen AI, and it should not be Gen AI taking actions and making diagnosis by itself. But the regulatory framework to approve, I think we need to look at it in a more in a, I would say, a unique way, because it's a different technology. A lot of models have a temperature setting which can be set to 0 in order to always return the same results if given a specific input. And maybe there can be multiple tests that are done on a model before it goes out into production. And all users of models can be mandated to set their temperature to 0 to make sure that it doesn't come up with unique and creative solutions where people's lives depend on it. But Sahaj might have other ideas.
Yeah, I think exactly what Sid said. What we've seen some companies do to this question of regulation is essentially just avoid the use cases where you might be high risk for someone getting you in trouble. So can you do the back office operations? But what Sid said, we suggest looking at the FDA's software as medical device. They've kind of laid out their framework for guidance, at least on what use cases should be certified for safe and effective use, and then what use cases can maybe not have to go through that. So if you're just outputting to a doctor, the trust is that the doctor will filter out the nonsense. If you are directly talking to the patient, then there's a high degree of safety bars that you have to clear, and then you have to get your software approved. So I think looking at that framework and then trying to sort of stay on the use cases where back office, there's maybe not as much risk for litigation.
Right. So having said that, so I think there's another question from Hari on mental health, and what are the kind of use cases when it comes to mental health with generative AI?
Yeah, seeing a lot of different applications arise, kind of a first level assistant to be able to answer your questions and help you in crisis mode. Maybe we've seen cases of suicide helplines and hotlines be able to automatically detect if someone is high risk, because if someone is messaging or texting or calling a helpline, how do you decide whose call you have to prioritize picking up or texting immediately versus not? So a lot of human operators have to be there, but this is kind of a machine in the loop for triage. And then we are seeing examples of companies like, I think Wobot and others, which are starting to do at least the chat level. I don't know if that answers your question, Harry.
Yes. So just to that, Sahaj and Siddharth, since we're speaking about the fact that there needs to be a lot more that has to be done, and it's still at a very nascent stage, right? What kind of clinical trials do you think would these kind of companies would have to go through before they actually launch something like this? I mean, because it's of course to do with somebody's health. So I mean, what's your take on the trials part?
Did you want to take that, or I can, whichever?
I think you probably have more experience on the trials part, but I can maybe answer from just as a software tool, not directly being So it's almost like we don't really take all EHR systems through a clinical trial before it is deployed. But that may change if you consider something like a medical device, or it's a, it's more of a product that you need a trial for. Yeah, I actually don't know the answer to this. Sahaj, any ideas here?
I think it will really depend, Smriti, on what is the outcome that you're trying to achieve. If you're trying to make claims of clinical effectiveness, if you're trying to make claims that your software is a stand-in or a replacement or a supplement to medical intervention, then the bar for then you will have to clear the clinical trial bar. And I think they're useful class of companies to look at is the digital therapeutics space of companies. There are companies that have and haven't necessarily done so well, Pear Therapeutics, for example, that have gotten FDA clearance as a therapy, but a software. But you can imagine something like Headspace. Does Headspace have to go through clinical trials, but still offers mental health support, CBT? So kind of I would say is like, what claim are you making, and what patient population are you tackling? That may determine what regulatory and scientific validation path you have to go down to.
Right. Sure. Makes sense. Thank you for that. So do we have any more questions for Siddharth and Sahaj? Is there something else, Sahaj and Siddharth, that you all would like to highlight from the discussion that we had today?
I think Hari
is asking, how will GPT help in medical education? I think it'll probably change it quite a bit if people are to, Sahaj has always come up with this use case of practice patients, give GPT being able to generate a practice case for a doctor and seeing if they're able to identify correctly what the diagnosis is or what the treatment should be. So that, and just in general, if you have questions on what to do. So for example, doctors are expected to learn almost all of the new research materials that come out, and sometimes that may not be practical. And medical education technically also consists of what happens after somebody leaves med school, and it is the ongoing journey of a doctor in keeping up with what's up to date. You could maybe think of just like how ChatGPT can now call external functions and identify what's new. Human doctors can tap into ChatGPT and ask what is the best treatment for this particular case, and that could itself provide evidence-based care. So, but Saj, any other?
Yeah, I'll give you an example. Hari, I think one India-specific stat to sort of know, and it's like mind-boggling, right? Is I think 6 out of 10 doctors that someone in rural India see are actually completely untrained. So the word doctor, right, is just kind of a in quotes. If I'm going to see a medical provider, they may not have that training. Now, one sort of view is, well, ban those people from delivering care. But if you do that, you're potentially going to be putting a lot of people at a great inconvenience and potentially harming their health outcomes. But what if you could support those unqualified or uncertified doctors in assistive technologies that they could use to enhance their own medical education? So I'm someone in a remote part of India, and I've seen a patient that's part of my cluster of villages. It looks like something I have not seen before. I've sent them away with some treatment. They're fine with it. But now, how about I just ask my assistant did I do the right thing? Was there anything I could have missed? Because I'm afraid that this patient might come back tomorrow really sick, and then his family is going to abuse me, is going to harm me, right? So medical education delivered not just to MBBS and MDs, but also to informal practice providers for their peace of mind of, okay, maybe I'm doing the right thing. Maybe I can improve. This stuff is going to be hard to sanction, but I imagine software being built that goes directly to these users. It may not be the official use case, but it becomes the unofficial majority use case for something like a Glass Health built for India, right? Which is mobile optimized, which is voice powered, stuff like that. And I know in the company where I work, our doctors, whether you want it, and my brother as well in the health system where he works, I think there's a formal study as well. Doctors are using GPT informally to get advice, to get checks, to get things done. So formalizing it for their use and their improvement. I think, Smriti, you asked the general point that we would say, the most tempting fruit in the healthcare space is always, can we replace doctors? And how quickly can we replace doctors so everyone can have a doctor in their pocket? What we would say is there's so many other use cases that are valuable, that are suddenly unlocked in the healthcare space, that have nothing to do with replacing the doctor, but have everything to do with providing better healthcare, better support and better services to people in the healthcare and pharma space.
Right. That's very interesting. There's another question. What should an early stage founder do to build a moat in the space, since tech landscape is developing, changing so quickly, and there are many businesses building on LLM. So can you please give some examples on this?
Yeah, this is a very good question, but also funny because Google, I think famously there was a memo leaked on Google where they just said there is no moat for AI. There is nothing we can do to make sure. And again, you're not competing with other companies. You're competing with other free open source alternatives to the LLMs that are going to get better and better. So I would say in the LLM business, even if you're talking about maybe specializing in LLM specifically for a particular use case might be a moat, but even that I'm not sure how much it will protect, but delivery is definitely a really good moat. So if you are able to take this technology and then you have a delivery network where you have a deployment already running and people are already using your software, that is a really good moat. And most EHR systems and health tech products are sticky in that people would want to use what they are currently using and not move away, especially if they are used to that, the practitioners are used to that, they have a lot of data. So that is, in my opinion, the only moat. Saj?
Yeah, I would echo that. Delivery, or I would call it distribution, implementation, for good or worse, health systems don't like to, many health systems don't like to invest in health technology or have to replace it. So if you get in once, for at least some amount of time, you'll be in there for a while. And at least like in a healthcare setting like India, where there's not a lot of entrenched software, that means there's space to be able to offer software, become the choice. And the more sort of organizations you're able to do this, I think the faster you're able to deploy it. Now, I think implementation speed essentially is worth it. So you could sort of chase a lot of small, or you could kind of go after the big health systems or payers or providers. If you're, my personal opinion would be, if you're able to go after the big players in the health provider or the payer space, and you're able to go from pitch to deployment as quickly as possible, then you have unlocked a health system or a pharma to be able to use your software. Because otherwise it's a very complex system to be able to sell software into. Generative AI didn't just solve that problem for healthcare, right? It's always kind of happened. So going to a CIO, CTO, CNO in a health system is still going to be the same thing, whether you go with a generative AI technology or, the latest other crypto or whatnot.
Right. Thanks for that. Thanks for answering that, Sahaj and Siddharth. I think we don't have any other questions. So I guess we can. I believe no other questions for Siddharth and Sahaj. So what we can do is that if there are any other questions from the participants, we can take those down and, you can take them offline post the session. But yeah, I think all said and done, of course, I think we're still far away, there's going to be a huge sort of transition that's going to happen in this industry. I think we're still at a very, very nascent stage, and let's see how, things sort of really pan out. But very interesting information, Sahaj and Siddharth, and thanks a lot for, giving us so much insight into this. And very detailed information, and thanks for sort of answering all the questions very patiently. So I'm sure the audience had a great time listening to both of you, and I'm sure I personally had a lot of great takeaways from this session as well. So we really appreciate you coming today and giving this insight to us. Thanks a lot for all the participants also to come join us and taking the time out for the GAI series, and we look forward to engaging with you all in future sessions. So on that note, I think I would like to wrap up the session, and thank you once again, everybody, for joining us today, and a very good night to everyone and great rest of the evening. So thanks a lot, everyone.
Thank you, everyone.
Bye.
Thank you so much.
Thank you, everyone. Thank
Bye.
you. Bye, Coach. Bye, Smriti.
Bye. Bye, Siddharth. Bye, Sahaj.